So good afternoon, everyone. I'd like to call the Virginia Cannabis Control Authority Board of Directors meeting to order. And the time now is 1:03 p.m. And determination of a quorum. We do have a quorum at this time with 4 members present to conduct business today. And our first order of business is approval of our agenda today. Do I have a motion to approve our agenda?
So moved.
Second.
Seconded.
All in favor?
Seconded.
Aye.
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 All opposed? Okay, our agenda has been approved. And next is our approval of our previous meeting, which was held on October 1st, 2025. Do I have a motion to approve our previous meeting's minutes?
So moved.
Do I
Second.
have a second? Okay, and all in favor? Aye.
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 All opposed? Okay, and our previous meeting minutes have been approved. And going on to the order of business here, first we're going to have a medical cannabis program update. Who do I have presenting this today?
Hopefully I'm coming on. It's Isaac Wright.
Hi, Isaac. Yes, you're on. You're with us.
Thank you. Thank you. Just getting used to the virtual meetings for the board. So,
Me too.
good afternoon, everyone, and welcome, Dr. Peace. I don't believe I've had the pleasure to present to you yet. But for those who haven't met me, I'm Isaac Wright, the medical cannabis licensing manager here at the CCA. Thank you to the board for the opportunity to talk about the medical cannabis program. So I'll hop right into it, and the overview of what I'm going to talk about. Highlighting a few items regarding the new systems we've been working on. I'll talk about general medical cannabis program participation, how my team strives to help those who contact us, and then I'll share some general industry data. So the new systems, of course, you've heard a lot about these, but the new CCA portal is available for use for medical certifications and for practitioners to issue written certifications. This is a big reminder for any practitioners watching that December 1st is the deadline to start issuing certifications through the new portal. And of course, existing certifications will remain valid, both those on the old form and those issued through the previous portal. We know change is hard, so another thing we're doing to help practitioners is to conduct a webinar this Friday, November 21st from 11 to 12 to help walk practitioners through the process and answer any questions.
Very good.
As time goes on and users get to know the system, we definitely want to hear feedback so we can work to improve where we can. So looking forward to that. Seed to sale tracking is the other big one, of course. A cool thing we just had last week was state user training. That was an introductory training for some additional staff, and then hands-on training at the facility with RFID scanners for enforcement and some others. And then back in the office, we had training on data and reporting capabilities. Kind of emphasize that we're still young with seed to sale. We're collecting data still, and it's going to be more and more useful, and we'll be able to gain more and more insights as time goes on. And interrupt me at your discretion or ask questions at the end, whichever you prefer, if you have any. And it's also the training at the facility also enabled us to support licensees using the system. So we've done that at 2 out of the 4 facilities so far, and it was nice to interact with them and help them kind of know what to expect and know what they're supposed to do. You'll recognize some of these stats from previous presentations. I have a couple new ones too, though, that I'm excited to share. But this is unique patients and dispensations. So for those who don't know, a unique patient is counted when a new patient purchases a product. So, a patient goes in, if they go in 5 times during this time period, they're only counted as 1 patient. And for dispensation, that's counted each time a single product is dispensed. All of our products are sold as each, not as like a quantity at the dispensary level. So each one of those is the dispensation of a product, no matter what the amount of product in that package is. The average for this is 4.7 products per patient per month for those who participate in the program. And I don't have the data on this part, but that could be some that purchase a lot and some that purchase one or even maybe not every month. Registrations. So patient registration, as you know, is never been required under the CCA. It's been declining for a good while. Those numbers were really high previously, but they're still dropping. Some patients and entities feel it legitimizes patient status, because it's like, oh, they're registered with the CCA or the BOP previously. And some states recognize registered patients, but not written certifications. The newer certification out of the new system looks more legitimate, is harder to replicate, and contains a QR code that can be scanned to verify validity. And we expect it to satisfy patient needs better than previous versions for this type of thing. For the bottom green line for parent legal guardians, that one last parent legal guardian that was registered finally dropped off. So we're at a 0 for this last quarter. And just a few registered agents, because if a practitioner includes them on the certification, then they do not need to register with us separately, which is fantastic and kind of saves them some money right there. This is a new, kind of a new chart that I put together. It's basically combining data from the old portal along with the unique patient data from the PMP. So you can see that the registered patient numbers from the old portal, which are in green, they represent the total number of patient registration received during that period. So it's reliable between July 2018 and June 2022, since patient registration was required during that time, right? But after that, it was no longer required, so you'd see it drop off severely. The other number that's useful to us that I've been reporting here for some while is the unique patient data. So I just thought this was a really interesting way to look back at 2019 to present to see, using the best numbers we have, how the program's grown for number of patients. And we'll have even better data through metric and seed to sale and the new licensing system. But this is kind of where we are right now and how we got here. So for written certifications, this is a number in the older portal. It's at the number at the end of each portal, so it's a rolling total. So certifications are added if they're valid at the end of each period, and they aren't included if they fall off before the end of each period. You can see the total number has been mostly steady over the past year, with a little bit of a sharper rise back in FY25 Q1. And if you remember from previous presentations, it's much steeper after that, as kind of that we got away from the paper certifications. Practitioner accounts, again, this is accounts in the old portal. The new portal is live, ready for use. It is in use. We're seeing more and more certifications in it, but it's not the primary way quite yet, but it will be very soon. The practitioner accounts rarely fall off. So the number in the portal, it's generally just risen because they only fall off if there's like, something bad happens to their license or they retire. Pretty much, otherwise they just stay as valid. This isn't a perfect number though. It actually, one of the reasons and one of the things we look forward to in the new portal, this includes some duplicate accounts. Practitioners would make more than one account for themselves, or it's just not a perfect number. Another number that I think is a little bit better is we recently created a custom report that counts the number of distinct email addresses used on certifications in the old portal. And so from August of this year to present, there were 603 unique email addresses. So that's kind of like, August, September, October, November. So like 4 months, 600 different practitioners issued certifications, assuming that none of them, mistyped their email address. which would have given us a second hit on it. So I thought that was an interesting thing there. This is pulling from like our customer service program. This is the total number of requests that have come in from the public asking for help or information or anything. We have a great team of program associates here that help the public with any issues they're having. Great personalities and are dedicated and want to do a good job and care about the public call again. So you can see the kind of an increase from, Q4 to Q1 here. And I think some of that could be cyclical with, the previous year, it came down and going back up a little. But it's also, as the new portal is live, we're going to have new users coming on that have issues that need some help. That's expected, and we're here to help if people ask us. So over this period, tickets were resolved in an average of around 4 hours, with a median of just under 1 hour. So most were resolved very quickly, but some took a little longer, but it still averaged to 4 hours and under for resolution, which is a big deal. If you have a patient that's at a dispensary that wants help with their certification to get in, we need to respond to that very quickly and make sure that we can help them right away and not answer an email the next day. So this is replies by count. This is the number of replies necessary to resolve a ticket. Obviously, one reply is fantastic and it drastically reduces from there. There's some really complicated situations that will have 5 or more tickets, but over a year, only having 10 or 15 that hit that level, I'll take it. The 591 at 0, they also log phone calls. So like if they log a phone call, they never reply to that. So they just resolve it. So that's where some of the those might come from. This is product registrations. So this is kind of a transition from how my team is doing to how the industry is doing. My team is responsible for also, in addition to helping the public, for reviewing product registration applications. And this kind of shows the new products registered by month over the past year and the types of products registered. Each new product must be registered prior to sale. So we go through a review process and, we have to approve it. That data goes to the PMP, the Prescription Monitoring Program, and that's how they're able to sell it at dispensaries. One thing about it is that each distinct quantity of the same product requires a separate registration. So if like a flour amount, which you see that the vast majority of products were dry flour, each distinct quantity of the same product requires a separate registration. So like if it's the same product sold in 1 gram, 3.5 gram, or 7 gram amounts, each one of those is a separate registration. And I like to emphasize that because while 2,064 sounds like a lot of products over a year, to me it does at least. A lot of those are flour, and it might be 5 different package sizes of the same product. So that's not really like a indicator of like distinct formulations, basically. What I know some people have been waiting for, this is industry sales data. This is directly from Metric. And the next couple slides are. This is what their reports look like, and I wouldn't have put it out here like this if it was on a projector, because I know there's no way you can read these unless you're looking at your computer screen. And hope you may need to zoom in at that. But this is the way the reports look coming out of it, and we can, edit them or create our own if we need them to look great on a bigger screen. This one and the next couple slides, July 1st to this morning, basically. That's 66,774,087.22 in sales so far since that date. It sounds like a lot, and it is a lot. And the only thing I will say about this is half of it. Like this is just sales. So from a processor's like perspective or the facility perspective, they have their own operating costs that they're dealing with too. So this isn't money they're taking home. This is the total sales, and they still have their own businesses to run too, which I don't have any insight on those costs. You can see down at the bottom how per month where it says quantity sold each. That's like I said, our products are sold each. There are quantity amounts that can be figured out, but they're generally sold by the product. So you can see the total number of products sold each month and the price for those. You want to keep looking at this, or can I move on?
You can move on.
Move on.
This is similar to a couple of the previous slides, or similar information. It's the market share by product category, and it's not surprising because they match up mostly with the products we've been registering, where most of them are flower. There's some concentrates, edibles, and then shake trim, which is a lower grade flower, basically. And then you can also, by month, the trending lines for those. So those kind of support the previous slides. And this is plant type summary. So basically the lighter green are clones. I'm sorry, the darker green are clones and the lighter green are from seeds. So this is kind of the plant type summary for this period, but it can give you an idea of the total number of plants that are out there too during those periods. It's a fair number across all processors. You're looking at, for July, 18,000 basically. And then that might be the highest amount, but ranging from 14 to 18,000 number of plants. So that is my last slide. I will click to the next one, but I'll pause for a second before I officially log off to answer any questions if you have any.
Any questions for Isaac?
I have a question. This is Roxanne. When you say the number of plants, is that the number of plants that are just on site at each grow facility, or is that how many plants that they're actually harvesting?
It's the number,
what falls into that category?
it's the number of plants at all facilities combined. We do have granular data as far as, what's at each facility, and even more for the type of plants. But for this venue, I try to just report out the gross, like kind of the totals, because I don't want to create.
You don't want to get in the weeds.
I don't want to get in the weeds. Thank you. I appreciate it.
And Isaac, I want to thank you and your staff there too. It's good to have hear some great things out of customer service.
Yeah, that part's important to me, so I appreciate you saying that.
Absolutely, absolutely. Okay, Isaac, thank you so much for your time.
Thank you, John.
Okay, and next we're going to have a regulatory update, and I believe it's going to be, I think I saw Sean up there.
You actually get Jake today, so
Oh,
Jake,
okay, we got Jake.
Jake's gonna step up.
Okay.
Been missing him.
Before I got started,
There you
Dr.
are, Jake. How you doing, Jake?
Hi, everyone. Dr. Peace, did you have a question for Isaac? I saw your hand raised.
Oh, yes, thank you. I did have a quick question. So, and maybe there's not much of an answer to it, but I was curious if the processors have to get products approved before they go onto the market. Is there also any kind of oversight as to, or explanation as to when they kill a product, right? They take it out of essentially out of their stores for patients, right? So this is certainly some concern if a patient gets used to a particular product and then without warning that product is no longer available to them.
Right. Was that second part explaining the first part too?
Sort of.
Okay.
Yeah.
So we don't have any control over which products they sell specifically, except that they have to meet standards. They are required to have a certain quantity of low THC products available. But otherwise, whether they're selling flower or edibles or concentrates, those are kind of business decisions that they're making based on patient demand. We've definitely had some patients contact us directly asking for a particular product type or what's going on with it or a particular product. And I'll pass that information on to the processors just to let them know that, hey, somebody's interest in this, but we certainly can't tell them you must make this now. So they're making
Yeah. Yeah, I mean, I get that from the perspective that these are business decisions, but if this is going to be a consumer, uh, a consumer and patient centric, model, then maybe some transparency around them making business decisions about not having a certain profit margin on a product when a patient is using that product would be important data to capture.
Sure. And there are products specific to medical programs, like even like high THC products, that it's important to, make sure they stay available or for patients that need them as markets change. So.
And I'll
Right.
just chime in. I think and again, not wearing my lawyer hat, but from a legal perspective, having a state agency tell businesses that they have to do something is difficult unless we have a statutory hook for that. And so far we have not had language proposed through legislation to give us that back end control to say, before you remove a product from your circulation, give us some kind of explanation.
Yeah. Yeah. I mean, I completely understand that, but for a patient to walk in 1 month and suddenly the medicine, literally the medicine that they are used to getting from that dispensary is no longer available to them, that in and of itself creates, stress for the patient.
Okay.
That's a good question. Thank you.
Mm.
Thank you for asking.
Okay, anything more for Isaac before we let him go? Again, thank you, Isaac, for that presentation today.
Thank you.
All right, Jake, you're on for the regulatory update.
All right, thank you, and good afternoon, everyone. My update will be very brief. It is mostly to make you all aware of some upcoming regulatory actions we have. Everything will be posted in Town Hall, like as always. It will also be posted on the CCA website. One of the actions actually does have an APA exemption, so there won't be a public comment period for that, but then the other action will undergo the full 60-day public comment period. And both of these actions reflect changes that are already approved by the board earlier this year. So again, this is really just to clear up some uncertainty with the language, and this is just kind of a heads up to let you know that we have these coming. But everything will be posted as usual, and I'll be providing more updates in the future. Thank you.
Okay, any questions for Jake? Okay, Jake, we appreciate it. I think you're going to be busy in the next couple months.
I think so.
Okay, and next we'll have our annual report.
That one is me.
Hi, Jamie.
Hey, how are you guys?
Good.
So you all should have received the annual report that the staff has worked very hard on. I'm very pleased with the report this year. I think they've done a wonderful job. As you can see on the slide, just some of the content areas in the report. It covers a little bit about the CCA. It gives a synopsis of the legislative and regulatory stuff that we've had going on. Medical cannabis program, public health and engagement, safe driving, and then finally the financial report. So I just want to say I'm really proud of the team for not only meeting their deadlines, but doing such a wonderful job on this year's report. As you're aware, this is required for us to submit to the General Assembly by December 15th. And if there are no objections or questions, then we will ensure that that gets submitted timely.
Jamie, does that require a motion to approve?
It does not.
Okay.
The report can be submitted by the authority.
Okay. And yes, I've reviewed the report and it looks great. We appreciate all the hard work.
Thank you.
Okay. Any questions for Jamie? Reference our annual report.
Nope.
Okay. Thanks, Jamie.
Thank you.
And next, I'll open up the public comment period. I'll just read just a very brief statement before we open up for the first public comment. The CCA board and staff value public input. People who would like to speak before the board must submit their intention to do so in a form available at the CCA website. The form must be submitted no later than 24 hours before the scheduled board meeting. The form also allows the submission of a written comment to the board. The board will now turn to the requested comments that we've received on a timely basis. As a reminder, each speaker is limited to 3 minutes. And let's see who we have. Who do we have up first, Jared?
I believe we have Chip A.
Chip A, are you with us?
Chip, you should be able to unmute and speak to the board.
Chip, are you there?
Hello.
Hi, Chip.
Hey guys, how are we doing today?
Good.
All right, so first of all, the last 2 meetings I have followed through with the proper channels and not been able to speak. So I have some notes from the last couple meetings that I can email you guys, but basically it comes down to 2 things. A, the medical program is a disaster. Based on your own data, you have less than 10% opt-in. So taking any of the processes and procedures like that stupid metric thing that y'all spent $500,000 on into the rec market is a complete waste of time and will not work. The second part of this is that not a single one of you has mentioned anything to do with the farmers and the fact that there's zero assistance or help for anybody that's trying to get into the industry. You guys work with the multi-state operators. You know, Dr. Peace works with Columbia Care, just like the safety board co-manager. And they both gave presentations at the last meeting downtown full of inaccuracies. So if you guys are going to put out bad information, you need to make sure that you let somebody rebut it, because there's a ton of misinformation in the entire state about this program. So if we're going to move forward with a recreational program, we need to distinctify that from the medical program. Okay. The medical program is an adjunct failure, and anybody that's trying to transplant that into the recreational side is wasting their time. Okay. You guys talk about how this is a druggable and how you need to make it more medical for the patients. This is a plant, period, full stop. Okay. And the problem that you're having is you're letting these giant corporations who only care about profit come in here and try to dictate the terms. That's why you have crappy language and you have to make all these amendments. And that's why still 5 years later, we have no recreational market and essentially a state run monopoly. So if you guys want to do something to actually help patients and help the Commonwealth of Virginia, don't take any of the medical stuff and put it into the rec program. It's a waste of time and it's not going to allow fair competition. The only way this works is with free market competition. And you've already established that you don't want that for 5 years now. So if you're going to try to bring any of the medical nonsense that's not necessary into the recreational side, we're going to have a big problem. Thank you.
Okay, Chip, even though I disagree with some of your points, we do appreciate your comments today. And we'll move right along to, do we have Tom with us?
Yes. Tom, you should be able to unmute and address the board.
Great. Thank you, ladies and gentlemen. Appreciate your time.
Hi, Tom.
Hey, I'm a Virginia native from Northern Virginia here. I worked in the Maryland Cannabis program when it was actually in medical. As we transition from medical to recreational and adult use, we've gone millions to billions. Transparency is really important as we move along here. And jobs like Jamie's are very important because they share the transparency. They show where the money's going and who's managing it. It's important that this money is transparent and we know how to manage it and what's happening with it. A lot of promises in Maryland, a lot of promises in DC have fallen short. It's been very bad across the board. But as Virginia can do the right things and lead in the right ways, we must understand and not lose our touch with the medical patients here. Other states and other programs have lost touch with their medical patients. And the biggest failure that I see that constantly happens is the cost per pound of flour. DC's medical program has the highest cost of flour per pound. Yet Isaac works with strange units. We should be working apples to apples and worrying about the community in itself. Thank you for your time.
Okay, Tom, we appreciate your comments today. You take care. Okay, do we have anyone else on, Jared? I think we have just Jen Shepherd. That was a written comment that we'll put part of our minutes.
That's correct.
Okay, anyone else?
Not that I'm aware of.
Okay, well, that will close our public comment period for this meeting. And next, at this time, I will have to, I'm going to read to put us into a closed session. And then we'll all, then I'll let Jared kind of walk us through just to make sure that we all know how to log out and log back into to our closed session. But before that, I have to convene a closed meeting. I move that the Virginia Cannabis Control Authority convene a closed meeting under the Virginia Freedom of Information Act to discuss a matter lawfully exempted from the open meeting requirements under the following exemption: consultation with legal counsel and briefings by staff members or consultants pertaining to actual or probable litigation, which is found under Virginia Code 2.2-3711, subsection A7. The following non-members will be in attendance for the closed meeting to reasonably aid in the consideration of this topic. That will be our legal counsel, Jim Flaherty, Jamie Patton, and Sean Casey. And do I have a motion to bring the board into closed session?
So moved.
Do I have a second?
Second.
All in favor?
Aye.
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 Okay, at this time we are in closed session, and so we'll be leaving this site to go into our closed session Zoom board here. And Jared, you want to give us a little update how to do that?
Board members, you should have an email from me about that was sent about 12:20 with a meeting link that I will join you on in just a moment.
Okay, but you need us to sign out here and then rejoin later on.
Correct. I want you to
Okay.
leave this meeting because as much as we want to share with the public, your closed meeting information needs to be closed.
Absolutely. Okay, closing out, and we'll see you on the closed meeting
See you
side.
on the other side.
All right, get my bearings back here. All right, we're all popping back up.
I believe everybody's here.
Okay. With everyone here, I will read a statement to bring us out of closed session. Whereas the Virginia Cannabis Control Authority has convened a closed meeting on this date pursuant to affirmative recorded vote and in accordance with the provisions of the Virginia Freedom of Information Act. Whereas 2.2-3712 subsection D of the Code of Virginia requires a certification by this board that such closed meeting was conducted in conformity with Virginia law. Now therefore be it resolved that the CCA hereby certifies that to the best of each member's knowledge, only public business matters lawfully exempted from the open meeting requirements by Virginia laws were discussed in the closed meeting to which this certification resolution applies. And two, only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the CCA. And do I have a motion to bring us out of closed session?
So moved.
Second,
Seconded.
and all in favor?
Aye.
Okay. And Jamie, is that it for today? We have everything covered?
Sorry, Chair, you've got to do a roll call vote on coming out of closed.
Oh, okay, okay. So a roll call vote, again, is Roxanne Robinson,
Aye. Close.
Anthony Williams,
Aye.
Michelle Peace,
Aye.
and and Neil Amin.
Aye.
Okay. And myself, aye, to take us out of closed session. And is that good, Jim? We're good?
He indicated with the thumbs up. You're good.
Yes.
Okay. Okay. With that being said, Jamie, any other business that we need to discuss before we close out today?
There's no other business.
And when's our next meeting? Real quick.
Oh,
We're
That's it.
January, right?
Yeah, I think it's January 7th.
Wow. Well, so with that being said, I want to just wish everyone a happy holidays and have a safe and wonderful holidays with your families.
Thanks, John.
Thanks.
Thank you.
Thank you.
Okay.
Same to you.
Okay, with that being said, I declare that the Virginia Cannabis Control Authority Board of Directors meeting is hereby adjourned. Take care, everybody.
Take care.